Obviously, when we go into restrictions, you're not always going to see the benefit of that reflected straight away in the figures. Maybe over the weekend, we're starting to see some improvement. Is that how it's feeling to you? Do you feel like the restrictions are starting to show the impact that they have?
So, yes, I would agree. I think what we have seen is we saw last week peak in numbers, and it has plateaued essentially since that point, so sort of middle of last week to over the course of the weekend. We're still seeing a fair number of COVID positive patients being admitted on a daily basis, but we have seen a sort of like a peaking of that. Now, the sad thing is that peak has also come with a number of particularly unwell patients in ED, in critical care and through our COVID wards, and essentially what we've seen is a higher number of COVID presentations than we did during the peak of the activity in March. So we have seen that, and I suppose it's difficult to know whether the plateau means it's going to go down or whether it will continue to go up. But at the moment we've seen a sort of mild plateau, and I think that really is as an impact of the enhanced lockdown that we saw pretty much from the 1st of January.
And with that kind of enhanced lockdown having happened from the 1st of January, and you're saying it's plateaued a bit, does that still give you a little bit of a worry that maybe some people aren't maybe sticking to the rules as hard as they could do, or maybe just aren't taking as much care as maybe you would like them to?
Yeah, I think yes would be the answer. I think we're certainly still seeing a fairly high number of patients coming through the door, which would suggest that the lockdown has not been as fully compliant as the last time. And it may be part of the sort of like the hangover from people meeting up at Christmas time and at New Year and things like that. I'm also really conscious that the streets appear really much busier. We are trying to do as much as we can from a hospital point of view, but we do see an awful lot more people on the roads in the morning and things like that. So the lockdown, although is different this time, it does appear that there are more people out and about, and whether they're sticking to the rules as strictly as they did before, it's difficult to say. It is really difficult. I know how people have struggled with this. My own family have struggled with this, young kids and sort of like teenagers, but it is really, really important that people stick to it as much as possible to maintain their own safety more than anything else. The impact of the NHS is a bonus if they can stay out of the hospital, but to look after themselves, this is really what we should be trying to do.
And I suppose with where all the figures are and everything like that, clearly the decision always is going to rest with the Scottish Government, but would you hope to see that we're really cautious about how we move out of these restrictions?
Yes, I would like to see us being quite cautious about the step back into the tiered approach. I don't know when we'll go back. We'll be led very much by the government, but our numbers at the moment would suggest that we're not really there yet. And I think anything too quickly would have a negative impact on our health services and other services.
And just in terms of, as you say, that there's been a lot of people coming through your doors in the last kind of 2 weeks or so, obviously over the whole year, but especially then, and a lot of people who are quite ill. What kind of, personal and emotional impact does that have on yourself and your colleagues? Obviously must be really difficult.
Yeah, absolutely. The emotional impact on my colleagues and myself for this has been really, really quite stark. I've seen a lot of people who are just very tired, exhausted, not at the point of breaking. We're a resilient bunch. We just have to kind of get on with it. But there are lots of people who are clearly tired and have to just get up the next day and do it. And we do, but what we are seeing is that people, when they do become unwell quite quickly and then are off work for a wee while, which is not unusual much, but I think what we'll see is lots more people impacted on that. Any little bugs, any little things floating about will impact on people at a greater extent. And obviously we're encouraging people with any coughs and colds and any symptoms whatsoever to stay away from work until they get a test. But, at the same time, I think people are just a bit more, it's probably just a little bit easier for people to pick up things just now. Especially when we've not been mixing as much, and then when you do mix, bodies just kind of get closer together.